We are wrapping up Open Line tonight, but we still can squeeze in at least one more call. We have Rose on the line. Rose, thank you for hanging with us. It is your turn. The floor is yours.
Yes. Hi, everybody.
Hello. Good evening.
I have a question. Why is it when you go into these restaurants and grocery stores, you're so worried about this Delta and COVID spreading? They don't have to wear gloves. They don't have to wear masks anymore. And they forget about the children who aren't vaccinated and some of the adults who aren't vaccinated. How do they get away with this?
Okay, good question. Do you think we're in the right spot when it comes to unmasking, even with the vaccine out now?
Well, that's a great question, and you're absolutely right that we do have to be concerned about other people. And it's not just other people, it's also ourselves, because we may be vaccinated, but as Dr. Martin said, it is a 95% efficacy and not 100%. So there are incidents of breakthrough infections even in vaccinated people, and we don't know how long it's going to last. So we were talking about booster shots, and you're absolutely right. With children, you know, a society is judged based on how our children do, and pediatricians are the #1 advocate for physicians, for our patients and for our children. And to really have our future generations thrive, we need to be looking out for them, and we don't need to be this selfish, and our leadership needs to be the first ones in line to help set that example for our children.
We've seen over the past couple of days, LA has gone back to requiring masks inside stores and groceries and just really anywhere inside. And I think it has confused a lot of people because they say, wait a second, I'm vaccinated. Why do I have to put this thing back on if I'm vaccinated? And it just, then it becomes frustrating, right?
Right.
Can you explain that, Dr. Martin? What's the thinking behind that?
Yeah, well, I think it has to do with how many unvaccinated people are left in the population, right? So if the virus is allowed to propagate amongst the non-vaccinated, then it puts all of us at risk. And so certain communities are making decisions to protect themselves that they're going to have mask mandates again. And, you know, hopefully we won't get back to that. Hopefully we can talk about vaccine uptake and vaccine adoption, and avoid having to take steps backwards.
Yeah. Let me see if I can sneak in one more phone call here. Michelle, we're running short on time, but I want to get you in. What's your question tonight?
Well, I have one of the statement about I had the vaccine, and then one is about the masking on the children.
Okay, go. Do you have a specific question about the vaccine or the masking?
Yes, I do. I'm a healthcare provider, and I was one of the first to receive the vaccine, which was December the 26th, and my second dose in January. With me being a healthcare provider, I've been exposed probably at least 10 times to COVID patients and have not developed COVID, as well as having one in my household that had COVID. In April, I went to my physician and had them do a blood draw to see if I had any antibodies. I had 0 antibodies for COVID. So I'm really not sure how I feel about how the vaccine is working. The second thing I wanted to say was about the children wearing masks. When you see people out wearing masks and they have constantly touching their face, when an N95 is barely workable, it's the size of a virus, more or less a level 2 or a level 3, which people are wearing, or even a cloth mask, it is not going to prevent this virus. So I would like to hear what they have to say.
We have about a minute left. Either of you like to chime in?
So again, I fall back on the data when it comes to mask efficacy. We can look back to last winter when you look at counties where mask mandates were in place and compare them to counties that did not have mask mandates, and the new cases per 100,000 were dramatically lower in areas where masks were enforced. Masks are, you know, they do offer you some protection, but the main issue with the mask is that it helps limit the spread of your secretions and your, aerosolized particles to other people. And so it's a way to say that I care about other people in the community.
Gotcha. Okay, we're going to wrap things up when we come back. Stay with us.